Hello, my name is Dr. Temitope Oyetuji, a family medicine resident in a Nigerian hospital. You're welcome to Family Doctor Lens, a channel created to tell stories from the hospital, stories about patients, about healthcare workers that I come across, as well as events that happen in my practice as a family doctor. First, let's begin with patients. In spite of the numerous challenges in the Nigerian healthcare sector, it will interest you to know that many patients still have positive outcomes. Thanks to the dedication and hard work of healthcare workers in different hospitals across the nation. Yes, there are challenges, but on this channel, let's celebrate our wins and educate ourselves as we share stories of survival and positive patient outcomes. On this very first episode, let's listen to the story of Zainab, an hairstylist who came into the hospital with ruptured ectopic pregnancy.
Ectopic pregnancy is a pregnancy that is said to occur when the conceptus implants anywhere outside of the uterine cavity along the tubes inside the ovary, in the abdominal cavity, in the cervix. If it implants outside of the uterine endometrial cavity. We see it quite often. Actually, it is said to occur about maybe 1 to 2 per 100 pregnancies. In this hospital, we see at least 1 to 2 cases every week. There are a number of risk factors for ectopic pregnancy. Commonly, infection, sexually transmitted infections, pelvic inflammatory disease, history of previous ectopic pregnancies, history of surgeries done on the fallopian tubes, other pelvic surgeries that may cause adhesions, history of a woman having had endometriosis. Then if a woman has had bilateral tubal ligation or gets pregnant, that can cause a risk for her to have ectopic gestation. Many a times, what will make a woman suspect that she is having an ectopic pregnancy is when she misses her period, she starts having abdominal pain, and she does a scan which shows that the uterus is empty, and she may see some vaginal bleeding. Mostly that's how women present, but when it ruptures, she may have fainting attacks, she becomes very pale, collapses, have bouts of dizziness, fainting.
I'm pregnant before, 2-month pregnancy. So sometimes I'll be feeling stomach pain, seeing stain on my body. I don't know, I just think maybe it's normal thing because this is my first time. So last upper week Monday, I saw stain on my body. So I even wanted to go and take my bath before I saw the stain. So small times I'm feeling stomach pain, thinking that I don't know, I just feel like let me just try myself and go and take my bath so that I can go out. So this is what happened. I don't even know how they rushed me to the hospital.
The treatment for ectopic pregnancy is mainly surgical. When an ectopic pregnancy is diagnosed, it can be managed conservatively. You can use some medical management for it or surgery. Ultimately, the treatment is surgical. You would open up the woman or do a laparotomy for her and remove the tube where pregnancy has implanted. It can be done using a laparoscopy as well instead of an open surgery. But generally, we use laparotomy for this, yes.
I feel so bad because this is my first time. I don't know much about it. So when they said they want to operate me, I feel so bad. I'm thinking that I don't know whether I'm going to survive it or not. So I was crying and I feel pain. So when I wake up,
After the surgery?
yes, when I wake up after the surgery, I feel pain. So my mind is telling me that I should be thanking God that some people are doing this operation. According to what my doctor told me, she said this my condition. Some people are surviving it, while some people die do not survive it. So but I'm happy after the surgery. When I feel pain small, sometimes I will happy because I'm still alive. Thank God I'm alive. I face a lot because I don't have money. I'm still managing my life. So when this pregnancy come, I don't want to do abortion. So I just want to leave it and keep on hustling that maybe God will still answer my prayer. So I don't have money. When I even see my bill, almost 100,000 naira, I feel like, God, why me? I don't have people. I don't have helper. So I feel so bad. So well, I thank God. Sha. You give me money. You are giving me hope. You are praying for me. A lot of people that help me, but my mom, my mom, she helped me a lot. She prayed for me all in the night. She was praying for me. She took care of me when I want to go and urinate. She's the one that will carry me. Even she really tried for me. I thank her.
The prognosis for ectopic pregnancy is quite good. A woman can lead her normal reproductive, she can have a normal reproductive life even after an ectopic pregnancy, because if the other tube is fine, she has very good chances of carrying a pregnancy, at about 80% chance. Of course, once a woman has had an ectopic, the risk of having another ectopic is slightly increased, about 6 to 12% chances of her having another one, but up to 80% chance of her having a normal pregnancy in future. Well, we have fared very well in the management of ectopic in our environment. More cases of ectopics are being diagnosed early because women, when they become pregnant and have ultrasound scans done, so more often than not, ectopic pregnancies are being diagnosed at an earlier stage and not when they have ruptured, and the prognosis for that is quite good. And generally, morbidity is much decreased when that happens.
I really thank them. They are so kind. They're so lovely. They take care of me. So they do the needful. They really take care of me. I just thank God. It's only God that can help them, that can reward them, because I didn't expect this from them. They really take care of me very well.
Well, prevention of ectopic pregnancy has to do with modification of lifestyle. As we have said, the risk factors many a times is caused by one of the main risk factors is infection, sexually transmitted infections, pelvic inflammatory disease. So when a woman is able to practice safe sex, use of condoms, reduction of multiple partners, that would help in preventing infection generally. And then other lifestyle modifications such as smoking can also reduce the incidence of ectopic pregnancy.
My plan now, my plan is to just focus my life. I will continue my working because since I thank God I have hand working, so I'll just face my work now. I will not have time for any man. So my work is my husband, my friend. My work is only my work I want to face for now before we talk about any other thing. What I want to tell them, just a little advice. because of what happened to me. Hadn't been, since I'm feeling this pain, hadn't been I know it's going to worse like this, I could have carried myself to better hospital. I was thinking that maybe it's just normal thing because this is my first time. I don't know anything about pregnancy. So what I want to tell them now, that anybody that is pregnant, any pain that they feel, they should not just take it like that, or they should just say maybe it's normal thing, it's not that much. No matter how it is, just go to hospital. Not this pharmacies. Go to better hospital so that they can check yourself. I don't know what happened to me. Maybe it's because of these small drugs I'm buying, just 50 naira drugs I'm buying, that's caused this to me. Hadn't been I know, I could have carried myself to better hospital so that they will check me well. What I want to say now, that anybody that is pregnant, no matter how the pain is small or big, please just carry yourself to the hospital. Go and do checkup and see what is going on. Don't just go and buy drugs or buy herbal drugs and be taking it. It's very risky. According to what happened to me, it's very risky.
The advice I will give women about ectopic pregnancy is that whenever they miss a period, they should try and come to the hospital and confirm the location of that pregnancy. Yes, ectopic pregnancy is a very serious condition, and it occurs as an obstetric emergency. But with time now and more facilities for detection, ultrasound scans, transvaginal ultrasound scans, we are seeing cases of ectopic at much earlier gestations and are being able to be managed more conservatively, thus reducing the overall morbidity and mortality of ectopic gestation.